Hello, good afternoon, everybody. And I would like to welcome you to the second Conversations with the Food Allergy Council webinar from the Mary Weiser Food Allergy Research Center at the University of Michigan. Our first conversation was so well received that we decided to make it a monthly event. I'm Dr. Georgiana Sanders, Professor of Internal Medicine and Pediatrics in the Michigan Medicine Allergy Division and Research Associate Professor in the Weiser Food Allergy Research Center. In addition to its research directive, the center is active in advocating for safe food and improved dormitory conditions for university students with food allergies, educating undergraduates about food allergies, supporting clinical trials in food allergy, and supporting the psychosocial needs of patients with food allergies. We are pleased that they are sponsoring this webinar series. Everybody who registered for this session will receive an email about our upcoming webinar schedule. We think you will find them just as informative and interesting as our previous webinars. In July, we will be joined by Nancy Plummer-Swendrus, food allergy nurse educator. She will be sharing insights learned from her many years working in our allergy division, as well as working as a school nurse who was involved in designing guidelines for food allergic children in the school on both the local and state level. Today, my allergy division colleague, Kim Menzel, counselor, and I will be discussing more of the issues patients and family members experience when dealing with food allergies. To introduce Kim to those who did not meet her the last time, she received her master's in social work at the University of Michigan, and she has an extensive resume in both private counseling practice and the education of other social workers. She provides ongoing support to our food allergy patients and their caregivers and families as part of our multidisciplinary team approach to patient care. She works very closely with us in the food allergy clinic, meeting with patients and their caregivers, and she also provides individual and group counseling in virtual and face-to-face appointments. Welcome, Kim. First, though, let's begin with a poll question to find out who is joining us today. We do want to know whether you're caregivers, patients with allergy, so that in the future we can hope to address all of your issues. Melissa, can we have that poll up, please? A little technical glitch here. There it is. Okay. So while you answer this poll question, I want to remind you that if there's something you would like to ask him, please submit questions using the Q&A function. We want these monthly conversations to be interactive, so keep these questions coming because they really drive what we want to talk about. With that, let's get started. Kim will begin with a short talk, then we'll begin taking your questions. Now I'll turn it over to Kim.
Hello, thank you so much for being with us today. We're so glad you could join us. And we're so glad that so many people were excited about the first webinar that we did make this a monthly event. I'll also be adding a blog to the Weiser Center's website to continue to expand on the topics that you bring up that are important to you here. So if you have topic suggestions for that blog, please share them. You can share them today as part of your questions so we get that information. So look for that to go live soon. So today we're going to continue with the overarching theme of our webinars, which is learning to be careful, not fearful. And so we're going to talk about more strategies that help guide that. And overall, we really want to focus on skill building, building confidence, and navigating the everyday life of people who live with food allergies. So as we know, there is an increased rate of diagnosed food allergy, which means more people are living with food allergy-related anxiety. To review those statistics, we know that at least 5.9 million children, which could be up to 2 per classroom, have a food allergy, which means anywhere you are, anything you're doing, there's going to be other people who are dealing with some of the same things you are. And we want people to know they're not alone. And this is an increasingly large group of people, caregivers, parents, and people diagnosed with food allergy. We also know that people with food allergy exhibit more anxiety even than some of the other chronic health conditions that we see, including insulin-dependent diabetes. And we think there's a lot of reasons for this. Likely, this stems from the fact that there is unpredictability. You live with uncertainty. And even when you're doing all the right things and using your tools, you're worried that the next unexpected thing could happen. And so this makes what people with food allergies live with a little bit different. And we want to speak to that. So nearly 11% of people who are adults have diagnosed food allergies. So today, we're going to talk about, well, first we're going to go back. Okay, thank you. So we're going to look at breaking the anxiety cycle, reframing fear-based talk, which only increases our avoidance and anxiety, and applying mindfulness. So this anxiety cycle, I want you to think of it as when you have fear of something, you have anxiety, worry, you might be imagining scenarios in your mind, and the more you do that, and the more fear-fueled they are, the more, obviously, you're going to want to avoid these things. But what happens when we do that? If we avoid, number one, it builds it up in your mind. You never get to face it, so you never see yourself successfully getting through it. So this reinforces the fear in your mind. It makes you feel like this is not something you can cope with. People will tell me, I can't do that. I can't handle that. And what they really mean is, I can't see in my mind a way to do this thing that I haven't done or that I've done before, but I had a negative experience associated with it. So now that's all I can think about. And our brains are trying to be helpful, so it is being hyper vigilant for things that we are afraid of. So the more we feel afraid, the more we have a fuel-filled narrative about a situation and activity, the more we avoid it. So we get initial short-term relief, right? Because we're very smart as humans. We try to avoid danger, things that are a threat, and that gives us a sense of safety, a short-term relief of, oh, okay, I'm okay. But long-term, we have increased anxiety. And if we're avoiding one thing because we're afraid of it, or multiple things, what will happen is anxiety tends to spread. And it could become more generalized, where now you start to avoid other situations that bring up a feeling of discomfort. So this fear talk, we all need to be taking a look at what kinds of thoughts and feelings do I have in any given moment. Dropping down into just being an observer, asking ourselves, what is my mind saying? What kinds of feelings am I having right now? Because we know that our feelings and our thoughts drive our behaviors. So if we can just notice some of the thoughts that become our stories and some of our emotions, we will have a lot of information to help us take action. We know that we can reframe our thinking. Thoughts are just ideas and pieces of information that come floating through our mind. Not every thought we have is true. Many of them are just pieces of information that came from somewhere. We don't want to believe every thought or feeling we have. We don't have to buy into every feeling and thought we have. We can just notice them. So we want to reframe any thought to be accurate and helpful. That's going to allow us to take action, which helps us to stop this pattern of avoiding things that make us uncomfortable. We can always find something that's within our control. Look to take action on what is within your control, not all of the many things that are always outside of our control. So let's look at a couple scenarios, which are true and helpful. These are things we hear in the clinic, things I've had people say to me. I'll say, so do you go to friends' houses? If somebody is 8 or if somebody is 17, I want to know, are you socializing? Are you interacting with other people? Are you doing the things that you want to do, or are you missing out? And sometimes I'll hear, no, I don't, my friends come to my house. Or I'll say, do you eat at a friend's house? Do you have dinner at your friend's? Or when friends get together and have pizza and they're hanging out, what do you do? And I hear over and over, it wouldn't be safe if I ate at a friend's house. So I see we've got some poll results about who's watching with us today. So a lot of parents, caregivers, 67%. And those with a food allergy, about half our audience. We've got no one less than 5. So a lot of 6 to 10-year-olds, 15 to 18-year-olds, wonderful. 19 to 24-year-olds. Excellent. Dr. Sanders, what do you think about these results? Who's here with us today? This is a good broad audience. Okay.
Sorry, I couldn't unmute. I think this is great, and I think it really points out, as we know, those of us who deal with food allergies, that the food allergy population is getting older. They're approaching college, adulthood, and we need to think about all these social situations where people are going to be having contact with other people and with food that there may be food around them that they're allergic to, and they need to worry about and think about how to deal with that. This is great.
Excellent.
We're glad you're all here.
We're so glad to see such a broad audience. Thank you so much. So we want to reframe. So I want it to go from, I can't be safe if I eat at someone else's house, to you seeing your way through, I can eat safely anywhere. If I practice, plan, if I communicate to other people, and I carry my auto injector with me, I can eat safely anywhere. Another one I hear, and this goes right along with what Dr. Sanders was just saying, our food allergy population is getting older. We have college-age students, we have people in the workplace, we have people now having their own kids. One we hear though is, I can't go away to college. I'm commuting. Not because they want to. It's a perfectly fine option if that's really what you want to do. But if it's driven by fear, we don't want any of your decisions to have to be driven by fear. We don't want you to miss out. So I want you to see your way through to what is more true and helpful. I can ask questions. I can go on a campus tour. I can choose a campus that's proactive and seems to care about people with food allergies. I can practice my skills to be in unfamiliar environments before I go. And what's true is other kids go away to college if that's what they want. So moving into what is mindfulness? I'm sure you've heard this term and you think, how can it apply to what we're dealing with? Well, mindfulness helps us with every sort of stress that we deal with in life. Really, all mindfulness means is I pay attention to what is going on in the moment. I notice what my thoughts and emotions are. I notice how they might be driving my behavior. Overall, we know that if we practice mindfulness, it helps calm our bodies. It helps settle our brains. It helps us to be more available to ourselves in the moment so we can make choices and not react from fear. It calms that fight, flight, or freeze response. And it helps to focus our attention so that we can be making the decisions that accurately reflect the situation we're in. So we want to be able to move to respond rather than react. And when we're very afraid, when we're in fight, flight, or freeze, we're just in reactive mode. So we're going to avoid, we're going to run away from things, we are going to stop doing things, and we are going to feel like there's nothing we can do differently. So mindfulness helps us to practice when I feel distress, when I feel discomfort, how can I come back to being available to myself? How can I calm my body and my mind? And Dr. Sanders and I are going to talk more about how parents and caregivers are the first, as you all know, you are the first role models for your children, for the people that you help raise, for the people whose lives you're in, and you're the coaches. So our goal is that you learn through our support, through all the great resources that are out there, how to model that food allergies are manageable, uncertainty is manageable. We all know we're living in a time with so much uncertainty, so we want to model to our children uncertainty is manageable. We want to also show we can engage in life, even when we're afraid, even when there's uncertainty. How? We ask you to keep looking at what is your relationship to your feelings about the food allergy and what's leaking out sideways. What are they observing? We think about things like our language. We want to keep it neutral. We want to have a calm tone that just is very matter of fact. An honest, ongoing conversation and very matter of fact tone that just suggests, I know this is hard. I know there are moments that you feel really scared. We can acknowledge a feeling and not build on their anxiety. Acknowledging someone's feelings does not make their emotion more intense. It actually helps them to calm and settle because they feel heard, and now with support, they can move into problem solving. So instead of, and we hear this sometimes because, of course, you're distressed as well. You're afraid. We know that. There's nothing wrong with the fact that you are afraid too, but we want to provide support so that you can talk and get your feelings validated. So instead of, your numbers are off the charts, we might think about saying, yep, Dr. Sanders says your tests show we have to keep avoiding dairy. So we're going to keep avoiding dairy for now. That's a really useful way to see ourselves moving forward. So remember, you model how to navigate danger every day. I mean, you're teaching them to worry about traffic when they cross the road, how to ride a bike safely, being able to go to a friend's house, navigate peer situations. You have these skills. You can do this. And this is what we do with food allergies. So we're going to come back to these grounding techniques at the end, and I hope that you'll join me for that. So now,
Thank you.
as we come back.
Okay. Thank you, Kim. That was great. The theme of careful, not fearful is a very important one for our patients. Research has shown that allergic children may experience more fear of eating, more school absences, even the children living with other health conditions, including diabetes and chronic digestive disorders. So at this point, I would like to take another poll about this question about fearfulness and ability to manage. And Melissa, if we could have that poll, thank you. And while we're waiting for the answers to this, and remember, there are no right or wrong answers. We just want to know how you're feeling. I'd like to talk about an audience question that we've had in many versions of this. And there are two, Kim, maybe you could talk kind of blended about these. One is that a child who's had a food allergy reaction at school right before it shut down, and now this person's afraid to go back in the fall. They want to know what they can do. But also, kind of tied to the same theme, is that a child who's passed a baked egg challenge in clinic, but he's still afraid to eat the baked egg at home. And what can we do? How can we help both of these children?
Yes, these are fantastic questions. Thank you. We know these questions are on a lot of other people's minds. We see these things at clinic all the time. I'm going to talk first about the reaction at school. So when we think about that anxiety cycle, this is a great example. Something happens that's frightening. And now we associate that place and that activity with this frightening thing that we experienced. And so now those two things are kind of wedded together. School, not a safe place. I'm afraid to be there. And then we go into what if and oh no's. What if when I'm there, it happens again? I didn't expect that to happen. So how do I know it's not going to happen again? So I just won't go to school. And we know, so Nurse Nancy is going to be with us in July. And one of the things she emphasizes to families is if we don't look at the anxiety and stress, then children will start missing school. When she was a school nurse, she said by middle school, they would start to see absence rates rise for our food allergy individuals. And this is just because it starts to feel scary. You start to get the idea that I can't be safe. So if you've had a reaction, now you're afraid to go back to school. We think about, okay, what is in my toolkit? And what is in my toolkit is I always know where my medicine is. So I talk to the adults who are going to be there with me at school. So my classroom teachers, the office, maybe the adults in my life will go back in before we go to school and start school. Go and have a conversation. Bring an adult from your life. Go and sit down with your teacher. If you have multiple teachers, go and talk to your teacher and say, I feel really afraid because right before shutdown, I had this reaction and now I haven't been back to school. And now I'm really afraid. I don't want to come back to school. So we want to say it out loud. And then we want to talk it through with our team. So we want to get reassurance and have a plan. So, all right, what will make you feel better? Your medication will be kept in the office, or is it in your backpack? If it's in your backpack, then who would you like to help you if you feel like you're starting to have symptoms? The other thing is reinforce to yourself that you do know what your symptoms are. So yes, it's unexpected because you can't plan for a reaction. But if I know what my symptoms are and I start noticing something, then I know I'm going to be able to do something about it. I know where my medicine is. I know there are adults there at school to help me. And I'm going to tell somebody. And then they are going to help me. Part of your food allergy action plan is knowing the symptoms, knowing where your medicine is, knowing that you can take your medicine and it will help you. So remember, talk it through, make a plan, and then don't avoid doing it. Practice. So I see our poll results. Most of the time I can manage. So some people are saying I have trouble managing, and we're seeing a lot of people that say most of the time I feel like I can manage. And this is great to hear. And I would be interested, part of what I'd like this to B is hearing from people, what are the strategies you've used in your families that have been really helpful? Because maybe there's another family who would benefit. So in terms of being afraid to ingest the food after you pass an oral food challenge, this is really common. And, you know, it's understandable. You've been told to avoid something, and now you're being asked to go ahead and start introducing this into your diet. And you're not used to the texture, you're not used to the taste, and there's this idea, no, how do I really know if I eat this? How do I really know I'm going to be okay? And so talking again through your feelings about that and saying, it's okay if I feel afraid, but my doctors assure me that I'm going to be able to start introducing this safely, slowly at home. People are going to monitor to see if I start to have symptoms. If I don't feel well, I'm going to tell somebody, and they're going to help me. Dr. Sanders, you hear people say this. What else would you say to people? Because we do want them to be able to start introducing that food into their diet.
Right. I like to remind them, to remember that they are well prepared for any kind of food reaction they would have. So as opposed to before they ever had a food allergy diagnosed, we go over and over with them the symptoms, we talk to them about when to use different medications. And so they're very much better prepared. And for people within a family, they're not by themselves. They have family members there when they're trying this. And so they need to understand that it really is very much the fear of the unknown, particularly for an older child, or even teenagers who have not remembered anything about what happened to them when they were younger. And so I think that's a very important thing to think about, that you really are very prepared. You have all the tools you need to deal with something if you would have a reaction. I think that's important to remember.
Right, right. And that if you do remember your first reaction, that just as Dr. Sanders said, it won't ever be that way again. It won't be this thing that no one expected to happen. You have your medication, people are on the lookout, and you have a plan. So that's wonderful to remember. I see we have a question about mindfulness.
We do. I would like to, though, maybe, because I know you're going to talk more about mindfulness and routing at the end, maybe redirect this a little bit, because we've talked a lot about how caregivers can help their children, how they have to, as a caregiver, you have to deal with your own experiences, your own feelings about what's happening, and then help your child to work through their feelings and learn how to take the not fearful approach. But I also would like to talk a little bit, looking at our older audience, what about the educating not just friends, because you get help from your parents when you're growing up, but when you go off to college or out into the business world, and you have these big business luncheons, times you have to go out, how do you suggest people approach this so they can lose their fearfulness for these new situations, and also having to approach people they may not know very well about the fact that they have food allergies?
I think that's a great question. And number one, to recognize you might feel embarrassed or nervous, but recognize that that's just a feeling that you're having. It doesn't reflect how other people are going to feel about you talking to them about your allergies. And so once you do it a few times, you're going to see that other people respond really well. And so being able to say, I have food allergies, I avoid shellfish, peanuts, and dairy. And so sometimes I won't be able to eat what other people are eating. Sometimes I'll plan my own food, but that is not because I don't want to share what's happening. And I'll let you know if there's something in particular that might be helpful to consider. And so letting people know what your allergies are, letting people know that if there's an option for you to contribute ideas to where you're going to go and eat or what's going to be served, that would be really helpful. But if they see that sometimes you're not eating or not eating what everyone else is, but they know that, then that helps them look at ways to be inclusive and to keep the conversation going. And also allows you to see that when I bring it up, inevitably in the workplace or at college, someone else is going to, oh yeah, maybe not them, maybe their sibling, or maybe someone they grew up with. And so practicing, this is my allergy, this is what I avoid, these are some of the things that I do to help keep myself safe.
Okay. One other hint that I reminded as you talk, I told that you're not alone in this world. I read you. First of all, there are other people with food allergies, but I was at a wedding last fall, and it was a friends who are Jewish, and they have relatives who are kosher that we know, and so we're all sitting around having dinner, and obviously they're not going to have the dinner. They had a salad, and they said, "Go ahead and eat. You know, we're going to keep kosher. Don't worry about it. We're used to this. No big deal." Because I do know some people in the business world in particular have chosen to have something very simple when they go out to eat. And I think, you know, they made no big deal of it, and we made no big deal of it, and we all enjoyed the evening together. So I think that's the other thing to remember is it's not just food allergies that keeps people to eat. Okay. Okay, so we have an interesting question here, Kim. And this is something that does come up a lot in our world these days. A parent asks, it says mindfulness is very interesting, but they wonder about tools and techniques that they can use to help people with ADHD who have difficulty paying attention and being focused in the moment. And how can you help them work through this?
Absolutely. Mindfulness can help with, it always helps our focus and attention. And so basically, if you begin by practicing as you move through your day, just a few times a day, just stopping and asking yourself, where is my mind focused? What am I noticing right now? And you might notice, I feel really distracted, my mind is racing. And so you notice that, but as you notice it, then you have the opportunity to just say, okay, I'm going to pause for a moment and take a deep breath. And kind of stop and then start again. Like, okay, where do I want my mind to be focused right now? What task am I trying to attend to? And in doing that, you allow yourself to come back to yourself, and out of getting swept up in a busy mind. And at that moment, oh, right, I'm trying to work on getting my backpack ready to go to school tomorrow, or I'm finishing up this math assignment. So you can choose when you ask yourself, you know, bring your mind back and then bring it to the task that you're choosing to focus on. And if you practice that over and over and over again, what you'll notice is, we call it building the muscle of awareness with the mind. It's mental training. And you will notice that you will catch yourself faster when you're distracted, and that you are quicker to bring yourself back. And you just do it gently without any criticism of yourself. It's just, oh, I noticed my mind was somewhere else. Just bring it back. And when you keep doing that, you will just find that you start to do it out of habit. And that really helps everybody, but certainly people who know that they have ADHD and already they have very active minds, and having focus and being able to finish tasks is particularly challenging.
Yeah, I agree. And I think it's important to come back to the familiar. The techniques, if you have a child with ADHD or yourself with ADHD, and you use certain techniques in situations with work, school, dealing with siblings for young children, those same techniques can be used in relationship to your food allergy. They don't have to be different. And I watched a mother of one of my patients who actually is a food allergy patient in a clinical trial with ADHD, and to bring him back to the moment, you know, and I think can be very, very effective with dealing with food allergies. So I think that's a great technique.
And use these skills when you are calm, not when you're in a crisis. So do it just when you're sitting. Take a moment and just practice noticing where your mind is focused, and then practice bringing it to where you want it to be. Because we remember then that our mind actually works for us, and we have influence over where it is attending to. So.
And so one other question, Kim, that I hear a lot from my food allergy patients, and we've talked a lot about how we talk to our friends, how we talk to business colleagues, but what can we tell our family to help them understand that my daughter's food allergies are serious and not a sensitivity, or, and I'm losing it, or
Yes, or an intolerance.
Yeah, intolerance, right.
Right. So this comes up a lot for people, and it increases their worry about things like holidays, celebrations, traveling with family. So really opening up the communication and sharing some good sources of information. So asking them to take a look at, you know, FAIR, and we're going to share those resources, has fabulous resources for people in your family to take a look at. And very quick, to the point, looking at, you know, what are food allergies, you know, that they are not a sensitivity or an intolerance, why people with food allergy, you know, an IgE mediated food allergy, it won't get better just from the child being exposed to the food randomly. That is not how people with an IgE mediated food allergy manage their food allergies. That it is an allergen and it must be avoided. And this involves reading labels, looking at ingredients, asking questions, and that, you know, a doctor has diagnosed this to be a life-threatening food allergy. And so really stressing, you know, it could be confused as just a choice or a sensitivity, but that it's not, and that there's medication that needs to be used to treat if there's been exposure to the allergen. And so having ongoing conversation and just being matter of fact about, you know, this is the way we do things in our house, and this is why. These are some of the things we've learned about how to travel safely, or things that we have to think about in our planning. And so we want you to be able to have time. We want you to be able to spend time, and all of us to enjoy that. But the thing that I need is for you to do things the way that we've been doing them, because that's the best way we can safely manage. And it's also sending the right message to the child, the teenager, the young adult, that everybody understands and supports you, and we're listening to what you need. And sometimes you get pushback. Don't take it personally, and recognize you've been dealing with this longer than they have. You've gotten some good information. They haven't been at those doctor's appointments. Maybe they've never, ever known anybody who had a food allergy. And so offer them information, resources, and then get support for yourself, finding out how other people have coped with the same issue.
Also, I have had patients who've had relatives that they've just not been able to convince. So if you're in that situation, if you ask the question, you're not alone. This is not uncommon. But as your child grows older, you can also use it as a teaching point for your child to say, okay, there will be people in the world who won't understand, and teach them how to work with that and to deal with that. And it doesn't mean, you know, this could be an aunt who loves them very much, but just does not understand what they're dealing with. So I think that it can also be used as a teaching point for your child.
Absolutely. Absolutely. And they'll probably experience this in school with peers asking, you know, why can't you eat this? Or why are you making such a big deal of this? And this practicing being able to say, yep, that's not a safe food for me to eat, but you know, I'm going to do what I need to do, but I understand that you don't understand. That's okay.
Question. This is an interesting question, Kim. Have you seen situations where an older teen copes by avoiding activities but won't acknowledge it because of anxiety? And how do you get them to get over that? And
I would say
focus
that's the majority of teens that I talk to at the clinic. They don't come right out and tell me necessarily I'm nervous, but when we're talking, they'll start to indicate they have this pattern of things that they don't do or things that they've never done. And when we ask why, it slowly kind of comes out. But I think just like all of us, we feel uncomfortable saying, I don't know how to cope with this, or I feel this and I don't want to have to deal with it. So it's another reason why they might not acknowledge it's because of anxiety, because they also know that if we're asking them and they say, then we're probably going to say, you should talk to somebody, or we can help you with that. And they want to avoid, they don't want to have to deal with the issue. So it's better just as, I didn't want to do that. No, I didn't want to go there. I didn't want to go to summer camp this year. Or no, I don't like going to their house anymore. I'm fine. I like being at home. And so just recognizing if you're seeing a lot of kind of missing out, not doing, starting to choose not to go places, do things, people that they used to spend time with, and now they're saying, no, I'd rather just be home. Just, we can ask questions and also understand they may not even know what's driving their behavior. They're just going with what their comfort zone is, which is, I feel safe at home. This is an environment I can control. And so telling them, you know, one thing I have to do as the person who cares about you is I have to give you practice doing things so that later in life, you know that you can do things. And one of the things we're going to do is look for opportunities for you to be socializing, for you to be in different environments with different people doing different things, so that you see that you can develop the tools to do it. And they might tell you, I don't want to, I don't need to. And part of our job is to provide opportunity and strongly encourage, and just say, you know, I wouldn't be doing my job if I saw that there were a lot of things that you weren't trying or doing, and my job is to give you opportunities to practice. So let's pick some things together that you'd be willing to do this summer.
Thank you, Kim. So that, you know, the cycle of anxiety is difficult. It's hard to work through. We can stand here and talk about ways to do this as a person trying to deal with anxiety, or as a parent. We know it's not that easy, you know. But what are a few of the key points that you think that could be helpful to our audience as they work through anxieties?
So I think asking them to tell you a little bit more about how they're feeling, put some feeling words to what's going on for them. You know, tell me more about how that is for you. I'm not having your experience, but I really do want to understand as much as I can. Tell me. And helping them develop language to be able to communicate about that. Sharing experiences that we've had in which we've had to do things for the first time, the things that were scary, things that worried us, how we did that in terms of getting a new perspective. Also looking at what are some things you might be telling yourself about why that's not something you can do. And how can we step back and get a bigger perspective? And how can I help you look at this differently? With anxiety too, we know we want to develop a toolkit of skills to use, like self-soothing. So starting to notice when you're experiencing a lot of distress and being able to do something like stop, take a few breaths, and notice I'm feeling really worried or nervous. Helping them to look at thinking it through to be able to get to a plan. So tell me, what are some ideas you have about how you might help yourself with that? Sometimes we might find that we are kind of in the position of, as long as we reassure, then they might feel better for the moment. So we want to start to hand that job back to them. I am here to reassure you, but I've already told you a few times today when you've asked me about, is this safe to eat? Or how I'm cooking the meal, what I put in it, and what the ingredients were. And I'm not seeing that me telling you over and over is helping you feel better. Let's look at some things that you could do for yourself that are going to help you to feel better. What are some ways that you can help reassure yourself? So it's recognizing anxiety, recognize what's driving it, dropping any embarrassment around being able to say, I'm feeling worried, and then looking at what are some skills I could use and what are some ways I could approach this situation differently. And mindfulness practice helps us tolerate the distress we have when we're having to even have the conversation or do the thing that's difficult.
Okay. Okay. Oops. Thank you very much, Kim. So, careful, not fearful, I think is very, very important. And I think we've presented some situations, younger children, older children, dealing with families, friends, going out into the world as an older person, older teen, a person into business, working as a young adult. And I know you have a few last words that you're going to say, and then we were going to do another mindfulness episode right at the very end. So I will be signing off soon. I want to thank everybody for joining us today. Remember, on July 16th, Kim will be speaking with Nancy Palmer-Swendrus, our food allergy nurse educator, talking about the transitions you go through with school, beginning from daycare all the way through college. And I think she's a wealth of information. You won't want to miss this. She's really very helpful. So I will say goodbye and thank you to all. Remember, Kim will be starting a blog, and I'll turn it over to Kim at the end of the session.
And I saw, before we do the practice, I saw there's another question about how to support someone if they tell me they have a food allergy. And I would encourage you to ask questions, to tell them, thank you for telling me. I'm really glad you trusted me to talk to me about that. You can do some research about what people with food allergies do to manage that. You can ask them, I want to make sure you tell me if there's something that you need me to know, if we're out together, if we're eating, if you're not feeling well. So tell me more about where you keep your medicine. How will I know how to help you? So would I call 911? Do I need to get an adult to help you take your medicine? For older teens or adults, would you want me to call 911 when you take your medicine? And just having an ongoing conversation, but the biggest thing is to validate the experience and say, thank you for trusting me. I'm going to take it seriously, and I want you to know that you have my support, and I want to learn so I can help be a good friend to you. So let's move into a grounding practice. So a grounding practice is something you can do in the moment when you're flooded with strong emotions. So our thought is it helps us slow down and calm down. So this one is 5, 4, 3, 2, 1. So if everybody can just sit where they are and take a deep breath. Now, 5 things you can see, and just name them in your mind. Name them. So I see an ottoman, a candle, the floor, a tan wall, my pants, and a lamp. What are 5 things you can see? 4 things you can feel. Anything. So if you're sitting in school, you could put your hand on your pants. You feel, I feel my leg, I feel my pants. I feel the chair underneath me. You could put your hands together. I feel the palm of my hand. I feel the floor underneath my feet. List 3 things you can hear. What's something you can hear in your house right now? 2 things you can smell. And then the last one, list something positive about yourself, or 1 thing I can taste. What this does is help us get out of thinking mind. Using our senses helps reset the nervous system, helps the brain to calm down, helps you to get focused on what is actually happening, not thoughts that you're having about what's happening or what might happen. So using your senses. There's also a star breathing practice. Hold your breath, breathe in, the count of 4, and breathe out to the count of 4. Breathing in, breathing out. And you would imagine this in your mind. It gives you something to focus on. And you would continue to do that slowly, just breathing in, breathing out, and feeling what that's like, just to feel yourself breathe. Give this busy mind a task, and its task is to follow the breath. So this not only gives you something to do in the moment to help anchor yourself, it also helps your brain your arousal system will calm and settle. Then you can come back to yourself and realize, okay, right now, what is something I can do that would be helpful to continue to support myself? Again, please join us on July 16th. Since you were here today, you will be getting the emails so that you can register for July 16th. And then on August 20th, I'll be talking with our clinical nutritionist, Elizabeth Hudson, who works with us at the clinic, and she is a wealth of information to talk about all of the nutritional concerns that people have. We'll be talking about FPIES, we'll be talking about food allergy, and so looking at dealing with life when we have to restrict some food and how to incorporate food in safely. You'll be getting an email with the food allergy resources. So please take a look, because these are resources that I refer families to every day. There's a fabulous blog, foodallergycounselor.com. wonderful, wonderful resources. FAIR's resource, Allergic Living has a great COVID-19 issue and an anxiety guide. And Food Allergy Canada has wonderful resources. So thank you for attending. Please follow us on Twitter. Please sign up for our newsletter. And we really appreciate you taking the time to be with us today for the Wiser Food Allergy Center to bring this webinar, and look for us next month.
Thank you, everybody. Have a lovely evening. Bye-bye.